Good morning. Thank you for joining me for the presentation of Course Project Part 2 for Human Relations Management, Nursing 522 at the University of Alabama. My name is Lindsay and today we'll be looking at a strategic plan to improve operating room case start times. Improving OR on-time case starts was identified as an area of need for the particular ambulatory center that we are highlighting today. SCOD is a freestanding ambulatory care center that provides surgical services, proudly serving the population in and around the North Alabama area. The surgical services provided are elective, non-emergent, and they are provided Monday through Friday, excluding the major holidays, beginning at 7. The staff arrives around an hour early to prepare for the day. The center is a for-profit joint venture microsystem, which is both physician-owned as well as the overseeing healthcare system. SCOD provides both endoscopic and surgical services, with the surgical services ranging from orthopedic cases with an example of an ACL repair to simple bilateral ear tube placements. The individual served are usually healthy, and that's classified by a pre-screening process, which is conducted by anesthesia, and also the patients have to have a low risk that requires surgical intervention. SCOD serves a wide range of ages. This facility is currently the only center offering minor pediatric cervical services within a 30-mile radius. They have 4 OR suites, 2 endoscopy rooms, 8 post-anesthesia care beds or PACU beds, and 15 pre-op/post-op rooms. The center averages around 30 to 60 cases per day, and they are accredited by Service for Medicare and Medicaid Services, CMS, and the Accreditation Association for Ambulatory Healthcare. So why is this a problem? Why are on-time starts for OR cases a problem? It's a problem because it tends to spread like a web, and it affects many other areas of the facility. So why is it a problem? It could lead to potential problems in areas such as patient satisfaction. Patient satisfaction scores are often a reflection of patient wait times. In 2011, CMS presented final details for the methods of reimbursement that they were going to use to adjust payments, and that would be based on patient satisfaction scores. Currently, SCOD holds a 95.6% patient satisfaction scores as compared to the national average of 94.5%. OR efficiency is also affected. Research done by Patricia Vasil outlines that the inefficiency in the OR leads to the shrinking reimbursements and the rising operational costs in that area. Surgeon satisfaction scores are a reflection of surgeon wait times and the availability of block scheduling. Management decisions and profit margins, these two go hand in hand. OR start times are affected. They do affect the allotted time of OR use for that particular OR. And this could affect the ability to schedule add-on cases, and it could decrease the total number of daily cases that are performed. Any last-minute changes in the order of the schedule or in the schedule often leads to wasted time and resources as well as supplies. Antibiotic administration is actually a core measure that SCOD measures, and it also affects reimbursement. The antibiotics must be administered within a certain time frame to be effective and meet the requirements that are made by CMS. So what causes the problem? What are areas that are leading to the delayed start times? Late surgeon arrival. This is a highlighted one for this particular surgical center. This could affect the workload for the remainder of the day. Other surgeons that have arrived waiting to start because they can't because the OR is backlogged with cases that have started late. Late patient arrival. This affects the patient readiness in order to move to the next process from pre-op to inter-op time. Starts are also affected by long turnover time in between cases. It takes to require to set up Some other reasons are staffing. Management decisions regarding staffing, they have to be changed, and those have to match the case workload, and that they ensure that there's enough staff to provide safe and efficient patient care. For example, AORN guidelines currently outline the importance of sterility. So recommendation 7 for 2018 covers sterile technique. They say that once a sterile field is created, it should not be left unattended. So this suggests that if a case is opened and prepped for the patient and the surgeon is late, that sterile field cannot be left unattended. So this requires the use of staff, which have to stay and watch over the sterile field to ensure that there are no breaks in sterility, and that could lead to overtime. Some unforeseen events, things like bed availability. Are there enough beds? Since they have 4 OR times and 2 endoscopy rooms, are there enough beds to accommodate the patients coming in to have them ready for their OR start time that's scheduled? IV access problems. Are they having problems accessing the patient's IV? Do we need to get anesthesia involved? Can we access one? Are we having to take them back and use gas and then start an IV once in the OR? And nerve blocks. SCOD currently uses nerve blocks like interscalene blocks for surgical interventions of the shoulder. They also use popliteal blocks for surgeries on feet and ankle. So let's take a look at some other research projects or plans that have been instituted and put into play. Research suggests that it's an ongoing problem in many surgical areas, both inpatient hospital settings and outpatient ambulatory centers. So first case start times have a major impact on the OR efficiency and are of vital importance. This study associated first-time case starts and highlighted how important they are because morning case delays have repercussions throughout the remainder of the day. The total amount of delay time grows larger as the day progresses, and that's highlighted as wasted time for the day. The UVA health system used morning OR huddles to improve their start times. In this study, they used a surgeon-led morning huddle prior to the cases starting, and that they used that time to discuss the needs of the day. The results showed that pre-surgical huddles improved on-time case starts, turnover times, teamwork, and the overall efficiency in the OR. Study conducted by Tain examined the effects of on-time, early starts, late starts, and how that affected the schedule of the day, how that also affected the setup time for the cases. The results showed that when the cases started on time and or early, that turnover time was reduced and that there were less time between cases. OR start times affect the surgical schedule, as well as setting goals for safe and effective patient-centered care, timely scheduled cases, and maximizing the OR efficiency and its utilization. The last research study highlighted used implementations of positive and negative reinforcements to improve the start times. Their policy was set into place to withdraw start times for any surgeons that have consistently late start times or arrival times, and they use positive reinforcements by providing monetary bonuses and giving positive reinforcements to the OR personnel for consistent on-time case starts. So our overall goal is to improve on-time surgical case starts. SCOD currently has a overall goal of 80%. On-time starts were identified through measurements of what we call lead times, turnover times, and patient wait times. Lead times is defined as an on-time starts versus late starts, and that's based on OR room entry time. SCOD has a 6-minute quote-unquote cushion time, and the current 3-month lead time reflects a 55% average for on-time case starts. Turnover time is defined as the time that is elapsed between the cases for cleaning, preparing the next case for the next patient. SCOD follows the benchmark goal of 10 minutes or less, and the current 3-month average for turnover time for SCOD is 9 minutes. Lastly, patient wait times are defined as the time elapsed from the patient arrival to the center to the patient OR suite entrance. So SCOD, their goal for the patient wait time is under 90 minutes, and their current 3-month average wait time is 58. So what's the plan of action? What are we going to do? After identifying the problem, the implementation of a plan for improving OR case time starts, and that's key to success. Starting this plan, we're going to do a process mapping, and that's Simon and Associates identify that is observing the current processes and the use of block scheduling and how are the start times being determined and distributed. Then we move on to analyzing the workflow of the operating room. How are they working? How efficiently are they working? Next, we gather past data, and that can be defined as however far back that you have data to gather. Past monthly lead times, turnover times, average wait times. Were there situations where the doctor had to wait on another doctor to vacate the OR in order for them to work? We're going to form a task force, and that needs to include members from each department. That allows an adequate input from all variables and all units that affect this one problem. We're going to identify key factors of cause. Why were the start times delayed? And that's by obtaining the past information. We're going to look for patterns. So who was late? Was it the staff? Was it the patient? Was it the surgeon? Is it consistent? Is the surgeon consistently late? Is one particular OR crew consistently late? Is there a good explanation for the surgeon? For example, did the surgeon have another case at another facility prior to their scheduled on-time start at this facility? We're going to set goals. We know the ultimate goal is on-time OR starts, but we're going to identify what small goals are easily obtainable to assist in reaching the overall goal. We need to develop a safe, effective, patient-centered goal that maximize this OR efficiency. After that, we're going to move to presenting the problem and submitting the past data for a leadership committee for their approval. So with the past data that has been obtained, we present that problem and the reasons why that there is a need for improvement. We need to establish a project start and completion date, and those are important for how long we're going to monitor this problem. How long do we need to collect the data in order to show improvement within a certain amount of time? So that's, for example, a year of gathering data and using this plan. Then we're going to brainstorm and implement methods to achieve this goal. We're going to present the plan to all areas, all units. Surgical services, notify the surgeons, possibly by letter, announcement, and getting the pre-op and post-op surgical staff involved, all units within there, even the scheduling and business office. Make sure that they're aware of the problem, make sure that they understand why there is a need for improvement, and for example, financial gains, to increase the reimbursement and make sure that everyone has clear instruction and are on the same page so they can work as a team in order to obtain the overall goal. Develop reinforcements, develop both positive and negative reinforcements, as one of the researches highlighted earlier in this presentation. For example, use incentives, bonuses, priority scheduling, or withdraw the block schedule or the open on-time starts that would be prime for the day to those who show consistent on-time and consistent late starts. Give rewards and recognitions. Then you're going to initiate what improvement methods that we have planned to use. Going to gather daily data and as well as end of month averages. We're going to keep the staff and surgeons and leaderships up to date with the finding. That could be done with posting the data where it's easily seen as a reminder of what we're doing, how we're doing. Reevaluate the plan. Gather the opinions of others. Maybe conduct a midway survey. Develop a survey that asks questions on how they think the plan is going, how they see outcomes being made or improvements. Lastly, if the plan is working, move on to policy development and adherence. If it works, make it official. Present the findings to the leadership and have a task force that's been working on this project develop a policy. So is the plan working? Steps to evaluate the plan to make sure that it is working smoothly is that consistent data collection and reviewing. This continuously puts that problem at the forefront and helps keep the problem in focus and reveal the areas that need the most improvement. Reevaluation is key to ensure that the plan is working efficiently. Reviewing new processes, observing the flow, gathering opinions and feedbacks from other individuals as the plan continues to develop. Keep the staff involved and listen to the suggestions that they're being made. They're on the front lines. The task force needs to be meeting and communicating what problems have improved, what problems have been unveiled during the improvement process, what are other things that need to change. Change is constant, and the healthcare industry changes every day. Develop the specific satisfaction surveys, either midway and post-plan implementation. So what are the favorable results? What do we want to see? We want to see an increase in survey results for the satisfaction. We want to see satisfaction improve for patients, surgeons, staff. We want to see a daily increase in the number of cases that are able to be performed. We want to see a decrease in scheduling conflicts. We want to see an efficiency and improvement. We want to see reduction in overtime. We want to see increased reimbursements. We want to see the improvement of the allocated OR time and that no time is being wasted. And of course, we always want to see increased and improved patient safety. So in summary, improving the OR start times can affect many areas for this facility as well as others alike. SCOD is currently in the process of gathering the past data to present the problem to their leadership committees, and that's in hopes of obtaining approval and so that they can begin their own strategic plan to improve their on-time OR case starts. Implementing strategic plans and methods such as this can be important and very beneficial to other goals and or policies that are identified that need to be tested, adjusted, or changed. So I thank you for your time, and I hope that I was able to convey just how important on-time case starts are in the operating room setting. These are the references used for this presentation.